So hey guys, welcome back again to my channel, Health and Relationship with Yara Rose. I hope you guys are feeling blessed and doing really good. Today's video, we're gonna go straight into it. This is my channel where, for those who don't know, I talk about health, anything health, relationship and sex issues as well. So today we're going to be talking about a topic, and a lot of these topics that I cover as well are things that actually happen to people that we sometimes deem to be strange or abnormal, but people do actually go through certain things, and there are things that we go through that we think it's normal because we become so used to it. But there are some people who go through, you know, a lot of anxiety, a lot of things that they don't talk about. And today's topic is one of those things that people do go through that some people will look at and think, oh, that's a bit strange. But it actually, unless you're in that person's position, you wouldn't know what they're actually going through. So this is just what I just wanted to cover this, this particular issue, just for those who don't have that much info on this, who don't have that much knowledge about this kind of issue, and for those who go through it, to just kind of like familiarize themselves with what you can do to help yourself, because knowledge is power. So it's good to know certain things and to educate ourselves with some information. Okay, so guys, I'm just gonna go straight into the video. Okay, so today we're talking about autophobia. Now, that this is a word I've never heard of before, and if you was to say that word to me, I wouldn't know what it is, but obviously phobia at the end has got something to do with phobia, right? So we're going to talk about autophobia and how to treat it, and how to, what to look out for and stuff like that. It's pretty, straightforward. So autophobia, from what I understand, is the fear of being alone, like when it gets really intense, of being alone. That's what it's called, autophobia. Now, I myself like to be alone most of the time. I don't really like to be alone, but there are times I find myself being alone. Times I do like my own space, but I don't think mine is that excessive or that intense where I feel like I'm scared of being alone, or I get anxiety of being alone. I like to be alone, but then some people do, have an issue with that. It's just something that they, they go through that kind of affect them in quite a few ways. So if you do know somebody that goes through something like that, this information might help you, kind of help them out. So please don't be scared to share this information, forward it on to people, share the love, okay? What I was saying and what I understand is that autophobia is intense fear, like fear of being alone. Now, it says here also, it describes someone who is irrationally afraid of solitude or isolation. So someone who is being ignored or abandoned, especially during an emergency, things like that can trigger someone's phobia, So if you consider yourself to be an extrovert type of person, for example, you probably prefer to be in the company of others rather than just be by yourself, right? So this isn't necessarily, there isn't anything wrong with wanting to be alone, but sometimes it's how far you go with it, and your mindset as well. So what I've got here is that it's not quite the same as loneliness, okay? But autophobia and loneliness can both increase symptoms tied to chronic stress, which is why both are important to manage and treat. Okay, it can be, I guess anxiety and stress can also relate to that. They can both be related to that. So now let's look at autophobia and loneliness. We need to kind of differentiate what these two mean, and then we can kind of move forward from that. Autophobia, also sometimes called monophobia or isolophobia, is a strong fear of isolation and solitude. Now, I mean, it will amaze you the amount of phobias that there are. It's incredible. I just thought phobias were kind of like, being afraid of heights, or, having a phobia of snakes or certain things. But as I study more, I get to know that there's phobias of having sex, which I've done a video on. There's phobias of, being touched, phobias of quite a lot of things. And I'm going to be sharing those with you, but this is incredibly interesting, So this type of fear, like I said, autophobia, can kick in both when someone is actually physically alone. All right, and also when someone dreads and anticipates being left all by themselves. In other words, it can be like an imagined fear, for example. So it's not really something that's happening, but they imagine themselves being left alone and how they feel, what would happen and stuff like that. And it does happen to people. This is something that you have to grasp. It does. It's not just a word. It does happen to people. It's not entirely known, to be fair, why some people develop autophobia, but it's believed that it's related to deep unconscious panic over being ignored, unloved, or unsafe. All right, so it often occurs with a history of trauma, and with other anxiety symptoms as well, or disorders. Autophobia can also overlap with other phobias such as agoraphobia, which is extreme irrational fear of entering open and crowded places. So these are two very opposite phobias. I mean, the one about being in a crowded place, that is quite not common, but we do know that kind of phobia exists, and people just don't like to be in crowded places where there's a lot of noise and stuff like that. And I do know that there are people who don't like to be in a closed space as well. Obviously, that is different from autophobia. Do you get what I mean? So we need to try and differentiate what all these phobias are, and then we can apply treatment to it. What is the difference with autophobia and monophobia? The term autophobia, monophobia, isolophobia, and eremophobia are mostly used to describe the same type of fear, that of being abandoned and left alone. So sometimes the term eremophobia is used to describe a deep fear of being isolated, while the autophobia is an intense fear of solitude or oneself. But overall, these terms point to the same type of mental health issue and are treated in the same way. Now, loneliness can be uncomfortable to deal with, okay? I'm sure at some point, you guys have been lonely, and it's part of life. There's nothing to be ashamed of. It's nothing bad, but you have to understand there's certain things that you go through. So loneliness, like I said, can be uncomfortable to deal with. Causes obviously sadness and even depression at times, and often increases symptoms tied to stress. So, however, loneliness does not usually trigger extreme feelings of danger with regard to like being alone. When someone is lonely, that person is not normally scared but sad. You see the difference? So if you're lonely, you're not scared of being lonely, but you're more kind of like sad of just being lonely. You know what I mean? Loneliness is considered a universal human emotion because we all go through it. That is normal and common when someone is alone a lot. Okay, now it's only when the fear of being alone starts to become irrational and disrupt someone's life that intervention is needed. Too much loneliness can be problematic for someone's mental health as well. Symptoms of autophobia has many characteristics. So it could be something like panic attacks, like anxiety. It could be hyperventilation as well, hyperventilating as well, and also social anxiety. There's also the PTSD, generalized anxiety as well, also the borderline personality disorder as well, and agoraphobia as well, like I mentioned earlier. The symptoms of autophobia can include both the mental and physical symptoms, so you need to look out for all these things as well. Just because you're experiencing one or two of the symptoms doesn't mean that's what you have. Okay, we need to kind of remember that. So one of them is being scared of being stranded and alone. This can include intense anxiety when thinking about being alone or secluded. You have self-hatred as well, low self-esteem, and sometimes depression. This can be tied to the fear of judgment and also abandonment as well. You also have being afraid of not getting help. In case of an emergency, this can result in the fear of going out in public, crowded places where the person blends into the crowd and is ignored or overlooked. You also have the fear of anything uncomfortable or unfamiliar. You also have kind of like imagining the worst case scenarios, including irrational fear of death, injury, or impending disasters if someone is to become isolated. Fear of strangers as well, burglars, intruders, or strange noises while at home. People do go through that, to be fair. Going to extreme lengths to avoid being isolated. Fear of fainting and losing one's mind, sense of judgment as well. Panic attacks and strong desire to flee from home. You also have the physical symptoms tied to increased stress and anxiety, such as the lightheadedness, sweating, shaking, nausea, loss of appetite, the dry mouth, increased heart rate, and sometimes trouble sleeping as well. You also have the higher risk of substance abuse disorders as well, such as alcohol, marijuana, to cope with the stress and anxiety. In children, sometimes it also tends to include tantrums, clinginess, crying, and refusing to just leave, a parent's side. We need to look into things like that and not just ignore it and think they're just being, a toddler or being a child. It could be more than that, okay? Now, let's look at the causes. They believe that phobias can stem from childhood issues, okay, kind of like as like an abandonment as well, or abuse, or low self-esteem, and sometimes genetic factors as well. I believe that some people are just born to be, laid back, reserved, but then some people have that extreme, fear of being alone just because of certain things they've been through, or certain traumas and stuff like that. So children being abandoned by their parents when they were very young, which causes trauma and anxiety. This can be a result in adults being afraid that all of the important people in their lives are going to leave or abandon them, basically. So being emotionally neglected and rejected by important people in one's life, history of PTSD and significant life-altering experiences as well. You have like the death of a loved one, an ending of an important relationship, especially early in life, which causes fear of being with that one specific and important person as well. A history of poverty and financial problems. You also have unhealthy intimate relationships as well, like a recent stressful event that exceeds one's ability to cope. Some of these things, I mean, I've personally gone through some of these things as well, and sometimes you have to, it's quite difficult at times, but when you're in that moment of going through certain traumas, certain stresses of life, it gets pretty hard for you to pull yourself out of that. Some people do it pretty easy. Some people, it takes a lot of work to do. But sometimes when you allow the fear to control you, that's when things get pretty messy. It's not everybody who is strong enough to kind of pull themselves out, especially if you're doing it by yourself. If you have loved ones around you who helps you pulls you out of whatever it is you're going through, then that will make your recovery even more quicker. But if you're doing it by yourself and you're keeping yourself alone most of the time and away from people, it's going to be quite difficult for you to get out of that zone quicker than it is. And then when you allow yourself to be consumed by what you're going through at that very moment, that's when it gets worse. It gets harder to actually snap out of it. You know what I mean? So try and surround yourself with people. Autophobia is not really a mental illness, but it is a phobia, which is kind of in the form of anxiety. That's the best way to describe it, in a form of an anxiety disorder. Treatments, guys, straight to treatments. There's things like therapy that they can do. Sometimes it's usually with the therapy they can do like exposure therapy or the cognitive behavioral therapy. There's a few things that they can do to try and help you out with that. Sometimes, I mean, like everything else and any other thing, it's not always easy for people to admit that they actually have something. For example, if you're sick, a lot of people don't like to admit they're sick. Or if they're going through something, they like to keep them to themselves. They don't want to accept. Say, let me use alcohol for example. There are people who are alcoholic. Don't come for me, I'm just using that for example, who are alcoholic, and sometimes some of these people are in denial of the fact that alcohol is not controlling them. Like some people find it hard to admit certain things. This is also something, if you need help, you have to be able to admit that you have something that needs getting rid of. Otherwise you're not going to recover as you should. I hope that makes sense. So to seek professional help, you do need to admit that, okay, I have this phobia and this is what I'm going to do about it. So I think some of the things that they do, psychiatrists kind of sometimes they let you kind of increase your time. They kind of increase your time of being alone and decrease your time of being alone, slowly, a bit at a time, for you to see how you cope of being alone. And I think eventually, I'm not a psychiatrist, so I can't comment on that, but eventually, I mean, there's techniques that they have, and this is one that I know of, that they increase your time of being alone for just to see how you cope being alone and how you respond to that. So CBT, which is the cognitive behavioral therapy, with that one is used to kind of help you change your thought pattern, for example, and pinpoint irrational beliefs that contribute to the phobia. So there are ways of going about certain things, also how you perceive your fears, and we react by replacing irrational thoughts with more realistic and empowering ones. So they help you with how you see things, and what to use, what you can replace it with. Slowly, baby steps. That's all it takes to get to somewhere. The other thing is feeling more connected when alone. I mean, just about everyone pretty much feels lonely and isolated at times. These are just things that we go through certain moments of our lives. But when somebody experiences normal amounts of loneliness and mild autophobia symptoms, it can be helpful to simply add more connection to the person's life, even when alone. So ways of feeling connected, you could be call other people on the phone, or using video chats as well, listening to music or playing background music. You could be listening to podcasts as well, or watching video games, watching TV, reading. There's a few things to feel connected to you just being alone, if that makes sense. Reaching out to others more, kind of joining clubs and teams, volunteering, asking friends and family to join you for dinner and other activities as well, going to church or religious places of worship, enrolling into a gym, things like that can kind of like help you out, especially if for most people who are surrounded by others 24/7, if you are not, get social support to kind of dull out those loneliness and fear. Okay, the next one is establishing a regular self-care schedule to reduce stress. So sticking to a predictable routine can help people with anxiety reduce their fear of unknown. So you can create a routine that helps you stay productive and limit stress by waking up and sleeping at the same time each day, exercising consistently, eating regular meals, and filling your day with other tasks and habits that fill your time, give you purpose and a sense of accomplishment. So it's good to have a routine, then you know what you're doing. It kind of helps you out instead of just getting up and then just waiting for the day to embrace you with something. I mean, that happens, but if you're in control of what you do every day, as much as you can, that kind of helps you out as well. So ideally, to deal with these phobias, try and regularly exercise. Also eating an anti-inflammatory diet, getting enough sleep, avoiding stimulants, caffeine and nicotine and stuff like that also is pretty huge. Okay, medication and mindfulness exercises as well can also help if that is the choice you want to go for. So I mean, that's quite a lot of things that you could possibly think of if you're going through something like that, or somebody who's going through stuff like that. Try and be there for them, and if you are going through these things as well, try and seek professional help. Don't just sit and allow it to control you even more. The quicker you do it, the better. Try small amounts every single day, and then eventually you're gonna get there. So don't beat yourself up. It is hard at times, especially when you've been so used to that kind of life, but try reaching out to people, try and get the help, and eventually you'll be good. So guys, once again, that was a quick snappy video. I hope you enjoyed it. I hope you learned something, if not a lot, and I hope that you guys share the video to your friends and family, and I shall see you in the next video next week, guys. So stay blessed and take care.